Hello, everyone, and welcome to Holistic Connections Conversations with Holistic Practitioners. I will let you introduce yourself and share what you do in the holistic healing world, please.
Beautiful, thank you. I'm Dr. Anastasia Ovechkin. I am a osteopath and a women's health coach. And honestly, what I do, favorite question. So I work mostly with women suffering from chronic pain, something like fibromyalgia, chronic pelvic pain, endometriosis, adenomyosis, PCOS, and migraines and headaches because they're all very, very closely related. So with my osteo side, I do. Do you know what an osteopath is? Have you ever been
Well, that
treated?
was going to be my next question, or at one point, I was going to ask you what the difference was or what is an osteopathic doctor. So, yeah, go ahead and explain that if you would.
I feel like because every single osteopath is so different,
Mm.
it's such an interesting question because everybody has a little bit of their own interpretation. But ultimately, what an osteopath is we take our knowledge of anatomy, of the systems of like in the body, and treat various conditions, right? So we treat manually. So some people, know what a physiotherapist is, but not so much as an osteopath. Similar, but also very, very different. So yes, we treat manually, but our scope and our knowledge of anatomy, I feel, is much more deep and intricate, which means that we're much more holistic, right?
Yeah.
So it's taking something like endometriosis, for example, or chronic pelvic pain. We won't just treat that pelvic girdle or that pelvic region. We'll
Hmm.
do some work through your feet because of fascial connections that
Oh,
run
yeah.
from the feet all the way into the pelvis. We'll treat the head and the neck and all sorts of different areas because everything is so closely related,
Yeah.
both from a structural point of view, so muscles, tissues, but also from a neurological and a nervous system point of view, especially when you're working with something as complex as endometriosis. You have
Yeah.
to incorporate that nervous system as well and managing and treating it. So that's what I do from the osteo side of things.
Hmm.
From the coaching side of things, it's very, very similar. I kind of went into coaching specifically because my scope is a little bit broader, whereas
Yeah.
with osteo, I'm kind of popped in this cute little medico-legal box and
Yeah. Yeah.
limit what I can tell my patients.
Hmm.
Whereas as a coach, not only can I have a bigger impact in terms of programs, but I can be a little bit more flexible and actually talk about, nutrition and talk about, trauma and a bunch of other things that are so
Yeah.
important for women, like for women's health. But I can't say, unfortunately, as an osteopath. So that's a little bit about me.
Yeah, that's really interesting. I didn't think about like the scope of practice as far
Mm.
as like when I think of medical doctors, and I always wonder why don't they say, more about nutrition and sleep and maybe supplements you might be taking or just your day-to-day life, because it definitely impacts your health. And if you've got something, anything going on that you're going to see any kind of doctor for, there's so much more to it than just whatever symptoms they're presenting with. So, yeah, yeah, that's really interesting. Thank you for that. That makes a lot of sense why you would have the coaching aspect along with the
Yeah.
osteopathic part of it too. Yeah.
Mm.
Yeah, that's amazing. So, are you seeing clients one-on-one? Do you do any groups or anything like that? And is it just in person or is it online as well?
It's a combination of both. So for my osteo specifically, it's very much one-on-one because you need that hands-on manual aspect
Yeah.
of it. Whereas with the coaching, I do one-on-ones on occasion. And I also run programs, but
Oh,
I'm very I don't have any specific set times for my coaching programs. I might just, decide to launch it twice a year or maybe once a year.
Yeah.
It's very much intuition based
Hmm.
because sometimes, for example, like I love what I do. It can be very mentally demanding though, because you're working with a lot of people who are suffering, who are in pain.
Yeah.
And, as much as I try and separate myself, you still take some of that on.
Sure.
So sometimes I might not necessarily have the energy to
Yeah.
give for, a group coaching session or a group coaching program. So I might not launch it that year, or I might launch a few, the following year. So
Yeah.
it's very much a bit whimsical.
Yeah, well, you're showing a good example of self-care. You're not
Mm,
going to do something that's going to be too taxing on you,
mm,
mentally or physically, because as we've said, they're all connected. So just showing that self-care of yourself is being a good example for all of your clients and patients, so that you're doing that when you feel like you have the energy to do it. That's great. Yeah.
yeah, I definitely, don't get me wrong, I definitely love to run it more often.
Yeah.
And in long-term goal, I'd love to have a really, really solid team of not just coaches, but also psychologists, somatic practitioners and
Right.
dietitians and nutritionists. So that it's a much more well-rounded program.
Yeah.
Because yes, I've got plenty to offer and I've got heaps of knowledge. In saying that, I'm not a dietitian. So in terms of, levels of knowledge, a
Yeah.
dietitian or a nutritionist who their area of expertise is women's health,
Yeah.
hormones, gut health, they're going to have a much bigger impact in the program in
Yeah.
comparison to just me, right? So it's going to be much more well-rounded. That's definitely a long-term goal,
Yeah.
but at the moment, since it's just me,
Yeah. Yeah, you're
yeah,
just one person.
it's one person, there's only so much that I can do. And, plus I also have endometriosis and adenomyosis myself.
Oh,
So there's a personal connection there,
mhm.
but also, if I've got a flare up, I might not necessarily be able to
Yeah,
show up as, the best version of myself
right.
for a program. So it's very, very whimsical, but
Yeah,
I love it.
yeah. And we should mention that your Instagram and on Facebook, the Osteo Den is who you are, the underscore osteo underscore den. And we'll put all of your links below. That could be a great name for a place that somebody goes to with all of those different
Modalities, yeah.
practitioner and experts and people working with
Mhm.
you, a whole team. Yeah, a whole team in the osteo den. How awesome.
Mhm. Yeah, I'd love to have it both as
Yeah.
an online version, but also a physical version for
Oh yeah,
people
yeah.
in Melbourne, in Australia, to have that space, like physical space for women to
Yeah.
actually come to, for women to be heard, to probably be treated and managed as
Hmm.
well. So I'd love to create an online version of that, but also a
Nice.
physical version too.
Very nice. So you mentioned a little bit about your own, personal struggles with health, with some of the issues that you have. Is that what got you interested in doing what you're doing?
Hell yeah.
Yeah, yeah.
Absolutely. I yeah. Sometimes when I think about all the things that I went through in life, I'm just like, how the hell did I even get here?
Oh, I know. I know.
It's
I feel that same way. It's like, oh my gosh. Yeah.
uh, yeah. So it's a genetic thing. So on my mum's side of the family, most women have some varying degree of endometriosis,
Mm,
and coupled with adeno as well. So those are very, very common coupling of conditions. And yeah, so ever since I was a very, very young girl, teenager,
hmm.
so my period started very, very early.
Mm.
I think I was about 8 or 9 when I had my first
Oh my
bleed.
goodness.
Quite irregular up until I was 11. That's when it became quite, I'm gonna say regularly irregular.
Hmm.
Because of my endo, I've never actually truly had regular,
Mm.
28 to 30-day cycles. But yeah, no, I really, really struggled through high school, barely graduated. Like I'm talking barely graduated.
Mm.
Even going through uni and doing all of my, my bachelor degrees, my master degree, it was Very, very tough, especially because I also have migraines, so migraines and fibromyalgia. And it was, like I said, sometimes when I think back on it, I'm just like, how did I graduate? How did I even get to where I am
Yeah.
now? And usually the only answer that I can come up with is I'm really, really stubborn. If I've kind of got like my set sight on something, it's just like I will, dig my nails and my teeth into it and I will get it. So I am very, very stubborn. But going through the medical system myself and realizing that not only was there massive gaps in care,
Yeah.
but medical gaslighting, especially for women, it's
Yeah.
a thing back then and it's still something that's incredibly prevalent.
It still
Ask
is. Absolutely. Yeah.
any woman, regardless of what she's going through, she will literally just be told, oh, it's just your period. Oh, you're just going through menopause. It's fine. Get
Yeah.
over it. Walk it off.
Or
So it's, and then when I started to study and then when I started to do my clinical work, that gap just became more obvious for me, which is
mhm.
also kind of why I went into coaching
Yeah.
because, as an osteopath, there's only so much that I can do and so much that I can say.
Yeah.
And it's incredibly beneficial and incredibly powerful. But sometimes just educating women,
Right.
because what astounded me the most was so many women don't know their own anatomy, really
Yeah.
basic anatomy. So many women don't know why they get a period,
Yeah.
what
I know.
happens in their body when they have
Mhm.
a period, or that they literally have four phases of their cycle and therefore are four completely different people sometimes.
Sometimes, yeah.
Sometimes, one time that you're completely not normal, but productive, you have energy, you
Right.
feel like you could take over the world, and then a few days later, it's you're depressed, you're
hmm
angry over tiny little things.
Yeah.
So a lot of women didn't even know their basic anatomy. It's not taught in our schools. It's not
Right.
taught in families, particularly
Yeah.
because periods and sex and everything, it's still really taboo.
Yeah.
I don't know why, but it's still such a taboo topic of discussion. So it's still kind of hush hush, don't talk about it. We don't want to talk
Yeah.
about it. Same thing was with menopause and perimenopause.
hmm
Don't know why it's taboo. Definitely in, certain demographics.
hmm
I myself was born in Ukraine,
hmm
European, and it was very, very taboo to talk about periods and sex and all that kind of
Yeah.
stuff. So I grew up with thinking that my periods were normal, that it was
Because you didn't
totally
know any
fine.
different. Yeah.
I didn't know any different. And my mum was like that too. And she was
Yeah.
like that when she was a teenager and other family members. So it was just considered normal. You're a
Yeah.
woman. That's what you have to go through.
Yeah.
So
My goodness. Yeah.
yeah.
So, do you share what you've been through with your patients? There's a train of thought that says don't share too much of your personal information with patients and or clients, but there's
Mm.
another train of thought that says share as long as it's relevant to their care. And I would think that a lot of women would be happy to know that you really know firsthand what they're going through. So, how do you handle that with sharing with your patients.
Honestly, I'm super open about it,
Um,
and if it comes up in conversation, and I mention it, in a lot of my content too.
oh,
It's
okay.
not
Yeah.
just, endometriosis and PCOS and a bunch of them, but even sexual assault,
Yeah.
right? And I'm very, very open with that because being on the other end as a
Mm.
patient myself,
Yeah.
it hits different when the person that you're talking to, or the practitioner that you're talking to, or the coach that you're talking to knows,
Yeah.
right? It hits different.
Yeah.
And, and it's a way of connecting too. It's more
Yeah.
like, girl, I get you, I hear you, I have been there, right?
hmm
So I'm very, very open about it, and sometimes I let people poke and prod at my own experience.
Yeah.
Ask me anything. You can ask me literally whatever you want, and
Yeah.
I'll answer. Whether it's professional, personal, doesn't matter. It's I feel like it allows us to connect a little bit differently,
Mm-hmm.
and it hits different for both my
Yeah.
patients and my clients when they know that I've struggled
Mm-hmm.
pretty much my whole life with migraines, with endo, that I've had struggles of, healing from sexual assault. So
Yeah.
it's, yeah, just like I said, it hits different. It's a
Yeah,
different
I
form of
agree.
connection.
Yeah, I totally agree with that. So, what do you wish that you knew before you started?
Even as a health practitioner,
Mm-hmm.
if I knew some of the things that I knew now, I would have changed the way I had managed my endo and my migraines from a
Right.
teenage point of view, which would have had a kind of domino effect throughout the rest of my both like academic career, but
Mm-hmm.
also professional career, because level of understanding is different. So, for example, with myself, I was just popped on the pill
Mm-hmm.
from a very young age. I think I've been on the pill since, or some form of contraception
Right.
since the age of 15, right?
Mm-hmm.
15. And knowing what I know now about the different ways that you can manage migraines and manage endometriosis and adeno, for me, the pill or form of contraception is just, it's a band-aid,
Yeah.
right? It just covers up some of the, not all of the symptoms, just some of it.
Mm-hmm.
And it can allow you the breathing space, for example,
Yeah.
to actually get your other ducks in a row. So, for
Yeah.
example, EMDR therapy or just
Mm-hmm.
therapy in general, because, and it doesn't necessarily have to be because you've gone through something as traumatic as sexual assault, right?
Mm-hmm.
It can be generational trauma, it
Yeah.
can be childhood trauma, it can be medical, like going through medical trauma,
Yeah.
right? So our bodies hold on to emotion, our bodies store it, right?
Yeah.
That's just one component, because it's a very, very multifaceted thing.
Yeah.
I would also know, for example, not to eat gluten or to
Mm-hmm.
restrict my dairy, or, that I'm nightshade intolerant. So, for example,
Mm.
potatoes, eggplants, tomatoes, and anything that falls under the nightshade family.
Oh my
So
goodness, that would
I
be so
could,
hard.
I know. It
Sorry.
actually, surprisingly though, it actually isn't, it's hard at first,
Yeah.
but now it's quite easy because for starters, a lot of my symptoms are managed, like especially my gut symptoms. I
Yeah.
don't feel horrible. And so when you don't feel horrible, it's kind of easier to just not eat that
Yeah.
food.
It's so
Every now
worth
and
it.
again,
Yeah.
don't get me wrong, every now and again I really miss croissants.
Yeah.
That buttery pastry, oh gods. Um, so every now and again, I'll just be hit with a craving of something
Yeah.
like that's just really not great for my body.
Right, right.
But that in itself would have curbed so much of my symptoms, and other things like, for example, a naturopath, right?
Hmm.
To help like boost my immune system, or
Yeah.
manage my gut, or there's even things like estrogen dominance. So for women with endometriosis and adeno, something that is very, very common is estrogen dominance. And
Hmm.
endometriosis, there's many theories of what endo actually is, and they're
Yeah.
constantly changing. But one of the theories is that estrogen dominance actually causes, or is one causative factor for endometriosis to grow more aggressively.
Hmm.
Um, but it can also increase inflammation, right? So I could give like a lecture
Yeah.
for like hours just about estrogen itself, but I'll try and
Yeah.
condense it as much as possible. But if we're just talking about estrogen dominance, there's so many components as to
Yeah.
why you have a lot of estrogen. One of the most common things is constipation,
Mm.
right? And you wouldn't think that.
Right,
So
right. So many
when
things are so connected. It's fascinating.
When we can't properly detox, so that detoxing happens in the liver,
Hmm.
but our body actually expels excess estrogen through stool. So when you poop or when you don't poop, when we have excess
Oh,
estrogen, our body technically should be recycling it, so
yeah.
we shouldn't be producing anymore, right? It just reuses what's already in our bodies. But because of endo and because it's a chronic inflammatory condition,
Yeah.
but it also mimics an autoimmune disease,
I was just thinking that. Go ahead.
so it's not technically classified as an autoimmune disease, but it
Okay.
does function like one
Mhm.
on multiple levels.
Yeah.
And there have been some recent new studies that have broached the subject. So I'm hoping, down the line, it will be
Yeah.
officially classified as an autoimmune disease.
Yeah.
But backtracking a little bit, because
Mm-hmm.
I'm going on a tangent, is, when we think about constipation, we don't really link it to our endo, and we don't really link it to even something like pelvic pain or pelvic floor dysfunction, or
Mm-hmm.
how it actually correlates with any symptoms or pain that we feel within our pelvic girdle as well. So, especially when we have a history of constipation, going back to childhood, it all kind of compounds on itself. But constipation, if you can't poop properly or if you don't regularly go to the toilet, we're not actually flushing out the estrogen
Yeah.
properly. Estrogen dominance or an excess of it can cause chronic inflammation, but it can also increase our level of histamine in our body.
Mm-hmm.
So, for all the women that are listening to this and they are wondering why they have such horrible allergies or hay fever,
Mm-hmm.
it just gets worse as the years go by, and sometimes even antihistamines aren't cutting it. If you have endometriosis, it's the estrogen dominance, and this is where we have a play in our immune system. So our immune system is already trying to fight our endometriosis growth, so it's trying to suppress that.
Yeah.
So it's constantly active as it is. So then
Yeah.
all of a sudden you have a massive influx of histamine production because of the estrogen. So then
Yeah.
your not your nervous system, goodness me, I have so many trains of thoughts happening at the same time because it's just like this is important and this is important and this is important.
Yeah.
There's just
Yeah.
so much.
Yeah.
Um, but it's also why we get sick. For
Mm-hmm.
us endo girlies and adeno girlies, we get sick all the time. Our
Mm.
bodies are just trying so hard to fight the endo, and then the high histamine levels, and there's just so much going on. Plus chronic inflammation. Endo
Yeah.
in itself is a chronic inflammatory condition, which is going to impact your gut, which is going to impact your whole entire body and your
Yeah.
immune system. So when you think about it that way, right, that it's not just go on the pill and it's fine,
Mm-hmm.
there's so many, it's just a massive umbrella. There's so
Yeah.
many things. So for, we kind of went a little bit, I went a little bit off topic there.
It's okay. It's
Um,
so interesting. It's fascinating. Yeah, go ahead.
just for personal experience, and
Mm-hmm.
women who also want to have a bit of a better understanding of how to manage it and what specialists to see, is understanding that there's no one thing that will
Right.
just magically make everything better. I wish there was. Oh my
Yeah.
goodness, I really wish there was, but there isn't, because
Right.
it's so complex and multifaceted that you got to go to that therapist.
Mm-hmm.
You have to make sure that you're seeing a gut specialist.
Yeah.
And making sure that your liver's properly functioning and supporting your liver functions, that you
Yeah.
can detox and expel that estrogen, and making sure that you're managing your constipation too, because
Yeah.
that can play a role in pelvic pain too. But that's a bit of another rabbit hole
Yeah.
in itself.
Yeah. So speaking of rabbit holes and talking about how everything is connected and all of the different symptoms, what is your thoughts on so somebody who has been sexually assaulted in their life, do you feel like that might play a little bit, but might play a role in some of these symptoms with the female reproductive organs and systems?
Oh, 100%. It's not
Yeah.
even a little bit, it's a lot more.
Wow.
It's the correlation between, and actually a recent study even came out
Oh.
that confirmed it. I feel like we've all
Mm.
kind of known it for a while.
It kind of makes
It
sense, but then people don't necessarily usually connect
connect and
some
correlate.
trauma, sexual trauma with your sexual organs. Yeah.
It's there's a few different angles to this,
Mm-hmm.
especially with sexual trauma, is we've got the nervous system side of things, is your body remembers. You might have, logicked your way out of it,
Mm-hmm.
right? Because we tend to suppress, right? We tend to hold on to
Right.
things. We tend to brush things aside as women, right? As women. And we our body holds on to it. So our nervous system holds on to trauma, but we can actually store trauma in our fascia as well. So fascia is a connective tissue within the body. It's almost like the glad wrap of
Mm.
of our body. It covers
Yeah.
everything. It covers muscles, it covers organs, it covers everything. So there's the nervous system side of things. And with constant activation of your sympathetic nervous system, so kind of like being stuck in survivor mode, so
Yeah.
that flight or fight mode, is it leads to something that we call chronic sensitization. So ultimately, that means that our nervous system becomes more sensitive to stimuli, both internal
Mm.
and external stimuli,
Wow.
and respond with pain or respond with
Mm.
fatigue or brain fog and a bunch of other symptoms
Yeah.
to stimuli that it wouldn't normally have that response to. So, a very basic example of this is if I poked you, that wouldn't hurt, right? You just feel
Right.
a poke. Like it wouldn't really be painful. If I stabbed you,
That would hurt.
that would be very, very painful. That would hurt, right?
Yeah.
When we have a sensitized nervous system, regardless of whether I poke you or stab you, that
Hmm.
poke is going to feel like a stab. Right?
Ah, I
That's a
see.
very, very rudimentary and very basic example.
Yeah.
But now you can think about that in a systemic way, right?
Right.
And this is where, for example, things like food sensitivities can come into play. Like an example is when I was a teenager, gluten never really irritated me that much.
Mm.
It just became more of an irritant the older that I got. And that was in part because I was constantly stuck in fight or flight mode,
Yeah.
constantly, right? Being in pain all the time, chronic pain, that also feeds into it. And then a little bit later down the line, sexual assault.
Yeah.
Then there's the other side of it, where as women, our pelvic floor has a guarding reflex where,
Mm.
with any physical threat or perceived threat, and even something like stress, right? If we're constantly stressed, our pelvic floor will constantly contract, right? It will
Mm.
shorten and lift all the time. And we don't even notice it because it's a reflex.
Yeah.
When we have gone through something like rape and
Hmm.
sexual trauma, that pelvic floor is just tight, it is guarded, it is just constantly firing.
Oh my gosh.
That
Yeah.
in itself will impact pain, it will
Hmm.
impact, in some cases, my theory is that it will even, to an extent, impact adhesions and
Yeah.
growth of endo and adeno
Hmm.
because of scar tissue, because of that constant contraction as well.
Yeah.
And for women who, for example, necessarily haven't gone through sexual assault, but are constantly overthinking, constantly anxious, they're not sleeping properly, they're constantly stressed, and, it's a chronic thing. That pelvic floor is constantly firing
Oh
all
gosh.
the
Yeah.
time, right? Which is why, being able to actually regulate your emotions and,
Hmm.
regulate your stress and regulate your nervous system is so important
Yeah.
because it helps actually allow us to relax our pelvic
Yeah.
floor. So and that's just two sides of it. There's many, many other sides to it too.
Right. It's just so much. It's so
Yeah.
fascinating how how much everything is connected.
Mm,
And that's, that's really the definition of holistic,
yeah.
everything's connected. So that's all so fascinating. We could talk forever on all of this.
Yes.
But so where is the best place for people to reach you?
Instagram would be the best way to reach out. Just DM me, shoot me a message, comment
Okay.
on anything. And if women in your audience want to chat further, whether it's some one-on-one coaching or just they have questions, they're
Hmm.
more welcome to reach out.
Great, great. Thank you. So we'll put that link in below in the description, but again, it's the underscore osteo, osteo underscore den. And so is there anything else that you want to make sure that you share or make sure that people know before we wrap it up for tonight or today in your case?
Oh my goodness. There's so
There's
many
too
things that
much,
I want
right?
to share. It's too much. I think if I were to give just women a couple of things, like take home messages,
Yeah.
is understand, yes, we kind of know that endo is super complex, but
Yeah.
a lot of women don't necessarily know what kind of specialists and modalities to reach out
Yeah.
to ensure that they have a really, really solid management plan. So I would probably suggest for women to explore therapy
Yeah.
regardless of whether you've been through sexual trauma or not, explore that
Yeah.
because there are always things that pop up, right? Always things that pop up.
Yeah.
And make sure that you're also seeing a gut specialist, ideally a naturopath, in my opinion, for
Hmm.
your gut health. Once again, they tend to be a little bit more holistic and
Right.
use more, natural traditional herbs
Yeah.
to manage rather than just popping a pill
Right.
because there's nothing wrong. I don't have anything against medication. They serve
Right.
their purpose when needed.
Yeah.
But I think it's so important to understand that things like contraception, for example, it's a band-aid.
Yeah.
It doesn't stop the growth of endometriosis, it just hides its symptoms. But it's a good something to consider to
Yeah.
make sure that you're exploring other modalities in a way that you're not super stressed or super anxious because being on contraception 100% gives you so much more flexibility,
Hmm.
right? And having your symptoms masked temporarily to various degrees because it's very different from woman to woman
Yeah.
it can be incredibly important, right?
Yeah.
And understanding that your immune system plays a role into it to make sure to see someone who can boost your immune system function. Once again, I've got so much in my head. um, to gut health, therapy. The other thing that I wanted to talk about, this is very interesting one, is cycle syncing. Once again, I can go on a
Cycle
bit of
syncing.
a
Okay.
tangent on this, but for women who, for example, don't want to take any form of contraception, which is totally fine,
Yep.
cycle syncing. So syncing your lifestyle and your diet and your activities, gym, hobbies, whatever it might be, to the different phases of your cycle. So we have 4 phases of the
Oh,
cycle, and within each phase, what our body needs significantly changes depending on what hormones are present, and at
so
what
interesting.
levels.
Yeah.
So cycle syncing is an incredible tool. It can be a little bit harder for women who don't have a regular cycle on contraception because when we're on contraception, we don't actually have a natural cycle,
Right.
and the bleed that we get isn't your period, it's a withdrawal bleed.
Oh,
So it's
wow.
true period. It's our body bleeds because there's a withdrawal of the hormones.
Yeah.
And you're getting the exact same dosage of hormones every single day, our bodies actually don't go through the different phases of our
Yeah.
cycle. But in saying that, you can still implement certain lifestyle changes or certain little tweaks, both lifestyle and dietary and activity and work based on like a preset 28-day to 30-day cycle, for
Yeah.
example. So you can still implement it and turn it into a habitual thing so that when you start to come off of it, these habits aren't anything new and it will be a little bit easier to go through your body readjusting because there's a
Yeah.
huge readjustment period.
Yeah, I bet. But then that gives you sort of a head start. Yeah.
Absolutely. And in talking about head starts is if women are planning on coming off of contraception, please don't go cold turkey. Like, if I'm just going to ask one thing of you, do not go cold turkey. But also because it depends on, and this is where regular blood work is really important as well.
Okay.
Because I've noticed both through personal experience as well as through a lot of my patients and my clients, I cannot 100% say if there's any evidence or like actual studies backing
Yeah.
this. But for women who are on any form of contraception, whether it's progesterone only or progesterone and estrogen, so a combined contraception,
Yeah.
is we struggle with nutrient absorption, right? So the contraception is a factor in that, but our endometriosis in itself is a factor because of the chronic inflammatory side of things,
Yeah.
where the inflammation in our gut, so we can't absorb nutrients properly or to the same percentage or degree that another woman might, for example. So when you kind of come off cold turkey, you have to actually make sure that you're supporting your body through the transition.
Yeah.
So that might mean before you come off is making sure that you're getting an adequate amount of nutrients, minerals, vitamins, protein as well. Protein is a really, really big one. And for some women, and even I'm not too sure if they do this on your side of the world. They should technically, but vitamin IV infusions.
Oh, we do have them here. Yeah.
Yeah,
Yeah.
beautiful. For example, I get a few different kinds. So I get like a combination. But when I have a flare, I'll be doing my infusions a lot more frequently. Whereas in comparison to when I'm in a better state physically,
Yeah.
I might monthly or every 2 months. And infusions can be vitamin C, for example, other forms of antioxidants, magnesium. You can even get NAD, for example. NAD, super painful though, really painful. So I get them in, smaller dosage
Yeah.
boosters over a period of time. But you can tailor a little bit, even vitamin D, a B complex, all really, really important to supporting your body and
Yeah.
making sure that everything is functioning the way it's supposed to and supporting even, some of those nutrients and vitamins can actually help mitigate your endo. For example, vitamin D. Vitamin D has direct correlations of reducing the speed of endo growth and actual endo symptoms too.
Wow.
So infusions are a really, really great tool, and especially leading up. So you never kind of really want to go cold turkey
Yeah.
because your body most likely already isn't getting the adequate support that it needs,
Yeah.
whether it's through nutrients or whether it's through movement, whatever, even sleep, for
Yeah.
example, right?
I
And
think
then
sleep
also,
is so much more important than people realize. Yeah. Go ahead. Sorry.
no, so
Yeah.
I really don't want to go on another tangent of
Yeah.
sleep.
Sorry.
But yes, sleep is also so, so important. So that would be the other thing, is for women to actually make sure that they're getting not only an adequate like number, like hours of sleep, right? So 9 to 10 hours, but making sure that they're getting enough light sleep, that they're getting enough deep
Right.
sleep, they're getting enough REM sleep, right?
Yeah.
Because all phases of sleep are very, very important for different
Yeah.
things and for supporting your body. So, if you kind of go cold turkey, it takes some time for your body to kind of neutralize or kind of
Like a
almost,
wean
yeah,
and
a
a weaning out, a
weaning. Yeah.
transition state. Yeah. So
Yeah,
nothing is a shock to the system. Yeah.
absolutely.
Setting yourself up for success. Yeah.
Exactly. Because it can take some time for women to not only ovulate again, but also to have their periods regular and have their cycles regular. And
Yeah.
example of this is I came off of contraception just over 12 months ago, and I
Mm.
haven't ovulated since. I
Oh
have not
gosh, yeah.
ovulated once. My periods have been all over the place. My
Mm.
longest bleed was just under 5 months,
Mm.
right? So, it's a little bit all over the place.
Yeah.
I didn't go cold turkey, right? I did my best to prepare for
Yeah.
coming off of it. And then imagine a woman who does go cold turkey.
Yeah.
There is a level of every woman's very, very different here. So
Sure.
this might not apply to every single woman, but just good practice and good rule of thumb is
Right.
please don't go cold turkey.
Yeah, yeah. Just in general, no matter what, probably it's best
Yeah,
to wean, wean and
absolutely.
transition and not just boom, yeah, for
Yeah,
anything.
prep your body,
Yeah,
a few months in advance, make sure that you're getting that movement, make sure that, your diet's good, that you've
yeah,
got some habits for, having a good sleep regime, or even just habits in terms of cycle syncing, you
yeah.
know. So that's probably to try and keep it really short.
Yeah.
Yeah,
Yeah.
that would probably be the advice that I'd give.
Awesome. I have learned so much, and I want to express my gratitude to you for that. So I really appreciate you for that. And I know that the viewers and the listeners will also learn from you. And even though, like you said, just keeping it short and just trying to be as brief with these really in-depth subjects, there was so much there. And I think that you did a really great job explaining everything. So again, thank you so much. And look in the description below. We will put her link there and check her out and reach out to her if you have any questions or if you want to work with her. So thank you so much, doctor. And maybe we should do
Yes.
this again and we can go off on maybe just one topic or something.
Oh, that would actually be so great. Like, just
Yeah,
pick your brain.
yeah, yeah. That would be good.